It's a pleasure to talk to you one more time. We are at Venix TV, and we have a special program which was inspired or was an idea from our president, Mama Pipe. And this is about bringing the right people to talk to us and let us know what are the facts, because we are tired of rumors, we are tired of hearsay or gossiping, and we need to get the facts right, because when you're well informed, you can make the right decisions. So without further ado, I'm going to ask you to share, I'm going to ask you to call somebody, I'm going to ask you to ring your friends, let them know that it's going down, it's showtime. So I'm going to give you a few minutes to prepare, and then we're going to be right back, and then we're going to be right at it, and we're going to start. Thank you.
Présence là pour nous restaurer, ton souffle là pour nous faire du bien, ta présence là pour nous restaurer. Jésus est là.
Thank you and welcome back. This is the name of our program is Heures Chez Vous. In English, it is 8 p.m. at your place. So on the panel, on my right, I have my immediate right, I have Sister Elizabeth Tangata, and on my left, I have Mama Pipe, Mama President Pipe, and our guest tonight is going to introduce himself, but before he does, I just want to tell you that we appreciate you taking time to watch. We appreciate you taking time to share. Please make sure you share, because we need to inform our people. We need to inform our community. The reason why we're doing this is for our community. We need to get the facts right. So without further ado, I'm going to let our guest to introduce himself. He's going to tell us his name, and he's going to tell us a little bit about himself, and then we can take it from there. Thank you.
Thank you very much. My name is Wilson Nkurunziza, and I'm originally from Burundi, and I live here in Salford since 2005, okay. And I'm one of the local councillor here. My roles and responsibilities is to investigate the queries of our local residents, and also to try to influence local policies in representing the people's views. I wanted to be at the university in this country when I arrived here, and I did the first degree in economics, and then I did also a master's degree in social science. I'm also a social worker working with the vulnerable communities, particularly those who come under the Gateway Protection Program. Gateway Protection Program is a United Nations High Commission of Refugees who are coming from refugee camps. My daily work is to try to integrate them into community on top of what I do as a local councillor. Thank you very much for inviting me.
Thank you, thank you. I'm going to let Mama Pipe try to translate that in French, or even in Lingala, so that the people watching
you can... need to choose one for me. Is it French or Lingala?
Well, let's go with French.
Okay. Son nom c'est Kurziza Wilson. il a fait des études supérieures au niveau, il a fait les sciences sociales. C'est un social worker, je ne sais pas social worker c'est quoi en français. Assistant social, voilà. Assistant social. Et il travaille avec des gateway programmes, c'est les programmes des réfugiés. Donc, c'est les programmes où on fait la réinstallation des réfugiés qui viennent de l'Afrique, de l'Asie, presque partout là où il y a des réfugiés, on les amène ici. Donc, c'est un programme financé par les Nations Unies. Et il travaille également dans les communautés, toutes les questions qui ont trait au social. Donc, il s'occupe de toutes ces questions-là, au niveau de la mairie. Voilà.
Merci infiniment, Maman Présidente. Et maintenant, je veux passer à ma droite. Well, I'm talking French now. I'm going to ask Sister Elizabeth to fire the first question, because I know you're ready.
Okay. So the first question will be, welcome, Champion Councillor.
Thank you very much.
The first question will be, is COVID-19 real or a fake disease that is made up to control the world?
Yeah, I think first of all, what I will start by saying is to pay tribute to those who died due to COVID-19. And I do sympathize because many people have lost their families, their friends or neighbors. At least one person will know somebody who has died due to COVID-19. So this is time to pay tribute really. And I do know that we are still going through the pandemic. It is a very difficult time. So this is to say that it's real. So it's not about fake or to control the world or anything like that. It is a real situation. And when you look at the research, you know, all what we do, I'm not a doctor, I'm not a public health expert, but I do base on all my discussion on research, on people who knows about the public health. So I do know that in the public health, what they use to classify a pandemic is about what they call infection fatality rate. That's how they measure if this is a serious pandemic, how to behave, and all the policies comes under that. So when you look at that, it's about it's a proportion of infected people. So there is a disease, people are affected, and how many people are dying due to that pandemic. And that's where it comes to talk about the R is up to 1 or is less. It all depends on how many people are dying due to that COVID-19. So looking at this virus that is called COVID-19, people who are infected and who are dying because of that, it is a tragic. It is not something that I will have words to explain on how it's affecting. I'm sure in your community, it's also many people have been affected by this. So it's real. So people should take precaution and they follow the guidance, public health guidance, and the medical guidance that they get.
Okay, well, thank you. Mapipe, I don't know if you want to translate that, please.
Yes.
Can you try in Lingala this time? Just to mix it up a little bit.
Ok. And Monsieur Wilson a lobby que ma première question est pas à Elisabeth, ce qui est maladie ezali ya solo, to ezali omo ya lokuta ba créer kaka pour contrôler population ya mokili. Et il a répondu que c'est quelque chose de réel parce qu'il y a beaucoup de gens qui sont morts. Il a même demandé que si on pouvait garder 1 minute de silence par rapport à tous ceux qui sont partis parce que chacun de nous ndenge tofandi awa eza na mutu moko moko ayebi quand même mutu moko akufi na nzela na Covid. Donc ezali eloko moko eza réel, les eloko moko te ba créer pour na ko bangisa bato. Et en plus pour na ko déclarer que c'est une pandémie, il y a des études qui sont faites et que c'est par rapport à ces études-là que l'on peut dire que voilà, ça c'est une pandémie ou non. On a remarqué que ici, R ezali niveau ya malade ndenge ezali soki babino no ezali likolo ya 1 to eza na se ya 1 nde ezokolakisa ndenge nini maladi yali makasi ou bien maladi eza makasi te. Donc par rapport ya barecherche wana bamoni vraiment que maladi wana ezali pandémie et attaqué mokili mobimba, donc eza eloko bacréé kaka te mpona babangisa bato, c'est vraiment une maladie qui existe. Voilà.
Oh, thank you very much. So yeah, it's real. Now, my question is, before I go back, because I wanted to know a little bit of background of where you come from, because I know Burundi is a French-speaking country.
It is, yes.
So for you to make that transition to the UK and then study over here and achieve what you have been able to achieve, and you've done it being a father, you've done it, did you come here as a single person, and also the culture, the weather, how did all that affect you before we get into the COVID situation? I just want to go back a little bit to find out how was it when you got here?
Yeah. First of all, I arrived in this country on my own. I was not married at that time. And when I went to do my first degree, I was still a single person. But what I will say, it is not easy. But it's not to say it is not achievable. It is difficult, but it is achievable. It means you need to put hard work into it. And it is like when the production is a proportion to what you put into that to make that production happen. So you put an effort there. So I did not speak English. In Burundi, we do learn English at school. When I left Burundi, I was in my second year in the university.
Okay.
And then I left Burundi, I came here, but I had to restart again because I was in the French education system. So I went to do my English. I passed my English tests. Then I started my first degree, which I achieved with a good grade. It was a bit difficult. I had to work very hard to get to pass through all that. And then I passed that. When I passed that, I got my degree, and then I started working in the community. That's how I came to know people and other people, because the work she's doing in the community. Then that was a good experience for me to understand the environment, to connect with the people, and then that's what made me think to go to do social science. You can see I've switched from economics to social science. It was more, I got a passion to help vulnerable people because I could see, and the Mama people will agree with me, how people are struggling to get through the life in the UK and to navigate through the system in the UK. Then that's the reason why I decided to do social science, because it equipped me with enough skills, but we never stop learning, but we still learning, but equipped me with the basic skills to help people to change their lives.
Okay. Well, thank you very much. The reason why I asked that question is because here at Venix, what we're trying to do is we're trying to inspire our young people. We're trying to inspire our African brothers and sisters, because people come in this country and sometimes they have excuses, such as racism, they don't like me, I can't make it, I can't do this, I can't do that. So
and also
whatever language barriers and so forth and so on. But to have you come here from a French-speaking country, we come from a French-speaking country too. For you to come from that to achieve what you have achieved. I don't know if Mama Pipe can explain to people the position that is actually holding.
You need to tell us more about it so that I've got a clear idea, because it's quite broad. When you see someone who is a counselor, it's not something that is easy. If you can tell us a bit more about it, then I'll get a good picture.
Maybe specifically what you want to know, it would be good to give me some kind of key question that you want me
You
to...
are a politician, right?
Yes, to
How
explore.
did you get there?
That's a good question.
Well, which steps did you take
Yeah,
to,
yeah.
to,
Yeah,
like, to,
Yeah,
to,
yeah.
to
I think
become a
the
councillor?
the first advice or the first thing I did is education.
Et là, à Liboso, dans Saraki et Zaraki, dans des classes, la première chose que j'ai faite, c'était d'aller à l'école et d'apprendre.
Education is empowering.
L'éducation vous donne un pouvoir.
Mandela talks about the education, how it's a powerful weapon to change the world.
Mandela l'avait dit que l'éducation, c'est la seule façon pour toi de changer le monde.
Education is liberation.
L'éducation, c'est une façon de libérer les gens.
Yeah. So what I did in the education was to equip me with the knowledge to understand the environment around
Aller
me,
à l'école m'a permis de comprendre l'environnement où je devais évoluer.
to connect with the people.
D'être en relation avec certaines
There's
personnes.
no way you can connect with the people without the language.
Ce n'est pas possible d'avoir une relation avec les gens si vous ne parlez pas la langue.
You cannot connect with the people or empower the people if you do not have the skills to do so.
Et vous ne pouvez pas aider les gens à s'épanouir si vous n'avez pas la connaissance et les notions nécessaires pour que ces gens-là puissent s'épanouir.
Therefore, that education helped me to connect with the environment where I live, in the area where I live.
Donc, aller à l'université m'a permis de rencontrer les gens et de connaître un peu l'environnement où je devais vivre.
On top of that, it also gives you an ingredient to understand how the system is constructed.
Au-delà de tout, ça vous ouvre les horizons pour comprendre comment les systèmes fonctionnent.
And therefore, it gives you kind of a knowledge how to penetrate in that
Et ça
system.
vous permet d'entrer où peut-être que vous n'aurez pas pu le faire si vous n'avez pas eu
And
cette
then
connaissance-là.
be able to say, here I go, this is the way I need to do, what I need to
Et de
do.
vous montrer le chemin à suivre pour aller où vous voulez arriver.
And then that's how I became a counselor, because
Et
I
voilà
could
comment je suis
understand
arrivée, je suis devenue, comment on appelle conseiller en français?
conseil communal.
Ah, conseiller communal, voilà.
It gave me some kind of people to know what I'm capable of.
Ça m'a permis de rencontrer des gens pour me faire voir ce que je pouvais faire.
Therefore, I volunteered in the community in different projects.
J'ai travaillé comme bénévole dans beaucoup de projets dans la communauté.
By volunteering, you get people to know you and to see how you can change lives of
En
other
étant
people.
volontaire, en étant bénévole, ça m'a ouvert beaucoup de portes. J'ai rencontré beaucoup de personnes qui m'ont ouvert aussi des portes pour
That's
arriver où je suis
in a
arrivée.
few words how I managed to navigate and get through
Voilà
the
en
system.
bref comment je suis arrivée où je suis en ce moment.
Oh, thank you very much. Because I'm 100% sure that there's a young person out there that can. That's just what you just did there. That's like drawing a road map for a person to follow.
Yeah.
And education is the key, like you said. So thank you very much for that. Now, my question with regards to COVID, I want to know, where is the controversies coming from? Because this is not the first vaccine that we've taken or we've come across. This is not the first vaccine. And God knows how many vaccines we've already taken. But where is why the controversy is? It's leading to misinformation and to intoxication, and it's reaching a level which even people that you would think are educated, they're just running some lies, and they just all sorts is happening. So this is like a personal question to you.
Yeah.
What do you think? What's the controversy? Where is it coming from?
Very good question, and thank you for the question. In my opinion, is that this is a new disease. COVID-19 is a new disease, and there is a new disease which even the people who are public health experts do not understand. Even doctors do not understand. No one understands this new virus, but people have got different degrees of understanding. So misinformation, in my opinion, comes from that lack of understanding of this disease. So even the vaccine that have been developed, many people are building their misinformation based on the time scale on how the vaccine was produced. Because we used to know that the vaccine would take many years to be developed and to be available to the population. But this one was developed very quickly, understandably, because of the situation that we are in and how many people are dying every day. So that's where, in my opinion, where the misinformation is coming from.
All right, thank you very much.
La question posée par le présentateur est que can you repeat the question for me?
Controversy, where is it coming
Pourquoi
from?
les gens sont un peu sceptiques pour aller prendre les vaccins? Qu'est-ce qui fait que les gens ils sont trop hésitants pour aller prendre les vaccins? Alors, monsieur dit que c'est peut-être parce que, ça c'est son opinion à lui, il pense que c'est parce que les temps que ça a pris pour développer les vaccins, comparé au temps passé, nous savons que pour développer un vaccin, ça prend beaucoup de temps. Mais pour l'instant, on a remarqué que ça a pris une période assez courte pour que les vaccins soient accessibles à tout le monde. Ce qui fait que les gens sont un peu hésitants. Mais il sait qu'il y avait beaucoup d'argent qui était mis en jeu pour que l'on puisse développer les vaccins. Voilà que les vaccins sont là pour tout le monde.
Okay, thank you. So, I don't know if you have a question now.
I'll ask at the end.
Later, you always ask at the end. So, Sister Elizabeth.
So, my question would be, what do you think about the lockdown? Do you think it was necessary, or was it a way to really get people to, because there's a lot of speculation that lockdown was imposed on people so that when the vaccine comes out, everyone feels pressure to go and get it because we all want to get out of this situation. And
Can I add one question on the top of this?
Yeah.
We know that you're a politician, but try to be a community leader.
Okay.
Yes?
So what I'm going to talk about is it is all evidence-based.
Good.
And I'm not going to make up an answer. We are talking about science. And then the science gives you the answer that you need for each question that you are asking. If you look at the report that has been developed, I would start by explaining the background, then to make a sense of the lockdown, to justify why the lockdown is justified. Okay. If you look at the evidence, it appears in the reported by scientists, that one person is likely to infect 3 people.
Je suis en train de répondre par rapport à la science et par rapport aux recherches qui ont été faites. Donc, les recherches et la science démontrent qu'une seule personne peut infecter 4 personnes.
3 people.
3 personnes.
Yeah, 3 people. And then once that person infected the 3 people, those 3 people goes out there in the community and everywhere, in the shop, in the school, everywhere, and then infects other 3 people each.
Et ces 3 personnes-là vont aller dehors, dans les shops, dans les boutiques, dans les commerces, ils vont infecter encore 3 personnes chacun.
Yeah. When you do then the calculation, it shows that in a month, you'll be talking about 400 people infected.
Et au cours d'un mois, vous pouvez arriver à 400 personnes.
And that's from one person. Now we are talking about 400
C'était
people
une seule
infected.
personne qui était infectée. Maintenant, nous arrivons à un total de 400 personnes.
I found it justified because if you do not put measures to stop people meeting and then making contacts, therefore you'll be having that multiplication of viruses around.
Je trouve que c'était important de mettre ces mesures-là en place, sinon ça allait continuer à se multiplier, on aurait beaucoup plus de cas.
Therefore, it's justified, and it's justified, and that's why they're asking us to put the mask, 2 meter distance apart, and all those measures should be really looked at, not controlling people. It's not about controlling people. It's about safeguarding people.
Donc c'était important de mettre ces mesures-là en place, non pas pour contrôler la population, mais beaucoup plus pour aider la population à ne pas se faire contaminer. Voilà.
Thank you. Now, I've got a question, but I want you, if possible, to answer this question as if you were answering to my grandma. So, really slowly and plain language.
Yeah.
Now, this COVID-19, so far I know there's 2 vaccines.
Yes.
The Pfizer one and the
AstraZeneca. There is also Moderna.
Oh, there's also Moderna.
There is there is a lot now in China.
No, I'm talking about
Pfizer and AstraZeneca.
Yeah, because the way I operate is if I live in England and if I have to buy a car, I always go with the English because I know that it's going to be easy to fix. Because if you get something,
good choice.
Unless it's new, but if it's, you know what I mean, it's second-hand, it's got to be from that place. Now, so far we got them 2 vaccines.
Yeah.
Can you tell us a little bit about those vaccines as a counselor?
Yeah. The 2 vaccines.
The 2 vaccines, yeah.
The Pfizer and the AstraZeneca here in Salford, that's what we are administrating to people. And these 2 vaccines, I'm happy to report based on research again, 95%, they are 95% effective.
Can you please repeat?
These 2 vaccines, AstraZeneca and the Pfizer, they are effective at 95%.
Na couper sa réponse par rapport il y a ba vaccin mi balé autre ou ko ça na ville na biso ya Salford tous na Pfizer tous na AstraZeneca et na ko confirmer bino que par rapport aux recherches et par rapport à la science ils allaient efficaces à 90%, 95%. Donc c'est pour juste confirmer que nous avons 2 vaccins ici en Angleterre, particulièrement à Salford. Les 2 vaccins sont Pfizer et AstraZeneca et ils sont efficaces à 95%.
Okay.
And it requires...
I just want to add something to it, if you can forgive me that.
No problem.
Because 95%, that's quite a lot.
Yeah.
Now, remember, you're still talking to my grandma.
Yeah.
I have twins. I'm a twins dad, so I have twins. They're identical, but they're different. So this is a personal question.
Yeah.
Of the 2, although both are 95% efficient, which one you think you personally, or I don't know how it's being administered, administered to or given to people.
Yeah.
So which one you think you would fancy, or you would, or is it not people's choice, or is it just you given what you when you go there, you're just given whatever they decide, or you can pick?
Je suis parent aux jumeaux et mes jumeaux sont identiques. Je voudrais savoir les 2 vaccins qui sont là, lesquels on peut administrer facilement à quelqu'un. Est-ce qu'il y a un choix à faire ou on vous les donne comme ça sans que vous fassiez un choix?
Both of the vaccines, they are effective.
Which one is the best?
Personally, I wouldn't have any choice. I would go for whatever is available.
Okay.
The only problem with these 2 vaccines is how they are kept. So the conservation and how they are kept. So depending on the logistic, you will be given a certain vaccine according to the logistics that is available. And it is also based on the supply and the demand. So might get supply from Pfizer and they get AstraZeneca. So depending on, because the whole world wants the vaccine. Everybody is crying for the vaccine. So it depends on the availability. Personally,
Les 2 vaccins sont efficaces, donc que ce soit Pfizer ou que ce soit AstraZeneca, les 2 sont efficaces. Ça dépend de la manière dont on conserve ces vaccins-là. et aussi ce qui est accessible. Donc, ça ne dépend vraiment pas de la personne d'aller dire que moi j'ai besoin de Pfizer ou de AstraZeneca. Ça dépend de ce qui est accessible, de ce qui est sur les champs, et on va vous les donner par rapport à ce qu'ils ont. Parce qu'il y a une forte demande, c'est tout le monde qui attend les vaccins à travers le monde. Donc, c'est ce qui est là, c'est ce que l'on doit vous donner.
And then also it requires 2 doses. You probably know about this. If you are given a dose today, you will have to wait. You will have to wait between 3 and 12 weeks to get a second one.
Et il faut savoir que c'est donné en 2 doses. Donc, dès que vous obtenez la première dose, il faut attendre entre 3 semaines à 12 semaines pour avoir la dernière dose.
Okay.
And here in the UK, we have decided that we should go for 12 weeks to ensure that we can give a vaccine to many people, as many as possible.
Et en Angleterre, ils se sont décidés à prendre les 12 semaines pour pouvoir donner à tout le monde la chance d'avoir la première dose.
An extra question. Now, of the 2 that you have, I mean, you don't have a choice, but you can be given either one of them. Now, if will you be aware that this is what you're getting or not? And if you are aware, the first one that you're getting, if let's say is AstraZeneca. So if you get AstraZeneca the first time, the second time, are you going to get the second dose of the same, or it might be of a different one? Because I need to know.
Yeah. I am sure that if you get Pfizer, you will get a second dose of Pfizer. And they will also give you a kind of a card to put down what they have given to you.
Okay, so you will definitely know that it's Pfizer. All right, thank you. Yeah, carry on, please.
Yeah. So they have already finished those 2 doses. They inject you today. You wait 12 weeks, 3 to 12 weeks to get a second one. As I said, in the UK, we decide to give to many people, as many as possible, the first dose, because you get a certain protection. Then we can unlock the country so people can start to go to work and they open shops and the other things before we can give to the second one.
Okay. Now, an extra question again. Now, what about the 5%? Any percentage of people who, because it's 95%, somebody might say, okay, that means it's working for 95%. Just like women, when they take pills, it doesn't work 100%. They can still get pregnant. So with this, is there a situation, or do you have numbers of those that have been given and or who to whom it maybe it hasn't worked, or anything that can help people understand that, you know, that 5% margin can...
They are still in the phase of collecting information. So we are not yet there. So we still don't know, based on the evidence, the impact all that is going to have. But it is something that will come into light when is the right time. But at the moment, I wouldn't be able to tell.
All right.
But it's, with all the vaccine, there's no vaccine available out there for 100% of it being efficient.
Doesn't
it's
exist.
always...
Go on.
I do have a question. With the vaccine being out, there's also the possibility of vaccine passports. Now, there are people out there who are a bit worried and they feel pressured, like, because they say, you know, you're not obliged, the government say you're not obliged to take vaccine. It's up to an individual to make their own personal choice. However, with the idea of possibly having a vaccine passport, people are starting to feel like it's a pressure And it really does fall into the conspiracy theories that has been going around. They've been talking about this for a while, and they say this will happen and then this will happen. Don't you think this kind of gives power and strength? What would you say to the people out there who are doubting how things are going with the vaccine and the science?
Yes, can I ask one more question on top of that? At the moment, there's a campaign. No job, no job. What do you think about it? Because it seems like...
Very, very important question, and which is playing a part in terms of people not going for the vaccine and be hesitant to take the vaccine. Currently, I don't know anywhere that it says about the vaccine passport. Is just misinformation that we are getting in the people talking about it. But currently, there's no policy or anything that is telling people if you do not get the vaccine, you're not going to get the job, or you're not going to get the passport, or they will stamp your passport, or they will give you something to show that you have been given a vaccine. So far, there's nothing like that. But I wouldn't say, what I would say is I'm a kind of a person, if people are not taking the vaccine, they might have the reasons why they are not taking the vaccine. The most important thing to do is to encourage, like what you are doing here. It's about having that conversation with the people, explaining why the vaccine is very important for their own benefit, for their own families, for their own health. It's not about the government, it's not about the passports, it's about their families, direct families. So it's about engaging with the community. And I'm always a kind of person who want to give a kind of, who advocates for evidence, showing the people the evidence why they should take that vaccine so that they can make informed choices. So it's about giving the right information to the people.
But it's very normal for people now to be, as we said in the beginning, vaccines do take quite a long time before it's out there for the population. So it's only normal that people are feeling a bit feared. Is it not fair to give people that time to, think and reflect rather than feel like there's a bit of pressure out there to actually go and get the vaccine, and there's a bad name if you decide you're not going to get it, like you're not good, you're part of the problem.
If you ask me that question, I would say there's no time for that. And now we are talking about people dying. We are talking about people on ventilators in the hospitals. So the vaccine has been developed very quickly to make sure that we stop people dying.
Cases are declining. It means that the sickness is no longer there. Why do you still want us to go and get the vaccine?
For me, I feel is the effect of the lockdown measures. Once these lockdown measures are lifted, you will start to see the numbers going up. Remember when I explained about one person
can infect
three people, and the 3 people goes out, infect another 3 people, and then in a month you get 400. So those are going down because the lockdown measures were lifted.
And the schools and
then they were lifted before, then we put them in place, the government put them in place in January, and that's the kind of effect that we are getting now. So I'm sorry, if I have to advise somebody, I would say we do not have time to go around. We should take it as soon as possible.
I don't know. People still, they're still in their feelings and they're not quite
Unfortunately,
sure.
we don't have that time.
Well, I think it boils down to information, because a lot of people, like I said last time, we're in a bubble time when people have what you call social media. Everybody's a journalist. Everybody's everybody knows that you have an expert in expertise now, so everybody knows everything. I think that can be a problem at times, but it's good that people with the right facts or information can come forward, because if we do it, people think, because somebody got paid money, you got paid money. That's why you're pushing people. Do you understand?
But if they knew that the infection rate is still high, why do you ask people to go back to school? Why do you open shops? Why do you open pubs?
Very good question, but it is a very hard one because remember we have to balance between the economy. You still have to eat. You still have to do whatever where the money where it's coming from. So we need to balance the risk of infection at the same time balance with the economy. How can we safely open some kind of businesses where there's no high to limit the infection while we are waiting the things to go back to normal?
Are we going back to normal? Because to be honest, I don't even know what the meaning of normal now. It's really years back.
I do agree. I do feel that we will have to live with this virus for quite a while. This is the reality, and then we will have to adopt a new ways of living with this virus.
Okay, I've got another question. I don't know if you've taken the vaccine yourself or you've suffered from the disease, the COVID-19, or you've known somebody close to you who has gone through with that. So is there any experience like that you can share with us? Because somebody's watching there and they're thinking, I don't go out, I'm staying at home. I haven't been infected. I've not suffered anything. All people are saying, I don't know nobody who's suffered from this. So if you have, please share. At least people will know that it's coming from a good source. Yeah,
I have not been infected by this virus, thanks to God. But what I was looking at this morning, and yesterday and the day before yesterday, because in Salford we are making a progress in terms of the vaccination program. So far, I think I checked it this morning, we have done about 24,000 of people vaccination. I was looking at when I'm gonna get to my cohort. So now we are about to start the 7th cohort, but mine is about maybe 10. So, but I'm ready to cut it short. I'm ready when the vaccine is available to take it. And I do encourage everyone who's listening to this program, please, when you are called to get your vaccine, please do
I thought that as a politician, you are a priority list, you'll be the first one to be on the list to go and get the vaccine. How does it work then?
It does not work like that. It works on individual situation. So it depends on your health, it depends on your age, it depends on different things. In fact, at the moment, people who are working in the community could get a vaccine. Yeah, so they are eligible for the vaccine at the moment. You can, there's a way you can apply for it. Yeah, some of my colleagues have had their vaccine, but it all depends on when you are called. But I do encourage everyone who is listening to this program, please do go take your vaccine. It's a lifesaver. You will save yourself, you will save your family and your loved ones, your neighbors, and everyone.
Okay, I've got a question. So throughout the pandemic, there's been a lot of focus on the number of deaths. And although we know, like as you explained about the infection, one person will infect 3 and then these 3 will go and infect other 3 each, they've not really spoken much about the people who have been able to recover because, to be even on the news, they were saying, a lot of people who are dying from it, most of them were already elderly people or people with underlying diseases. Healthy people, younger, healthy people are more likely to survive and beat the virus. So why was it, why is there so much focus on the number of deaths and not recoveries?
Yeah, I think it's a balance that needs to be there to know how many people are infected and how many people are dying as a result of that. At the same time, it's also important to collect these lived experiences about having the COVID-19. I think it's something that the government should encourage. The government should encourage, particularly like a program like this ones, people to talk about what their lived experiences and how they have come through this. It will help some people there. I think it's something that we can continue to advocate and maybe see more about people who are recovering from this.
Because it'll look more like a fairly balanced thing rather than that just fearing, it's all about death. When you talk about coronavirus, all people hear is death. That's like, there's nothing.
Like
and you're just,
and then they are just pushing you forward to go and die.
It feels like a very unbalanced.
Yes, I do agree there's no balance there, but it should be, they do talk about it, but not enough as the same as people are being affected and they're dying from it.
Well, I think, in all fairness, when people survive something, it's special. But when somebody dies from it, I think the one that dies from it kind of overshadow the other one. And that's why we have that impression that they don't really talk about those who are surviving the thing. It's like they talk more about divorce than people getting married. Do you know what I mean? It's like, because there's a lot of drama when there's a divorce, but when people get married, it doesn't really make news unless they're like superstars and all that. Because I've been following, in some countries, you'll see all three, like people dying, those infected, and those who
there's even a TV
exactly,
where
you can
they
see it.
show it on a...
Yeah, but I think the emphasis is always on the dying. It's just natural. When you look at it, you're like, whoa, 1,000, 100,000 people have died. It's a lot. So it's
so scary. It seems like
of course.
we are on the queue and then you are next one.
Yeah, but we are actually on the queue because
not
people
with COVID. We are on the queue, but not with COVID.
No, but I mean, people are actually dying from it. I'm sure you've heard somebody has died from it, so it's no joke.
Yeah, it's not
what I mean? So that's why at Venix, with program like this, we trying to let our people know the facts.
Yeah.
We don't want to bring just rumors or speculation, because anybody can do that. But when you bring facts, it kind of give peace to people. At least they know now what's going on and what they should do coming from the horse's mouth.
Definitely.
But now that very soon it seems like they are going to ease the lockdown. How about social distance, wearing masks, gels? What do we have to do with all of that? Are we going back to normal like we used to do? Hugging each other, going for a barbecue?
Very good question. Very good question. It is planned that the restriction will be lifted on the 21st of June, 2021. All the restrictions
everything
will be lifted.
At
the earliest, they will be 21st of June. But I'm talking about all the restrictions. But having said that, it all depends on the data that they collect. All the roadmap that has been put out there is going to be reviewed every 5 weeks. It means from the 8th of March, 29th of March, and so on, they're going to be collecting the data to see how things are going. For example, as we were talking that the numbers are going down, that's a good indication. Then you open a little bit, because as I said before, we have also to balance with the economy. And the number for reduction in the hospitalization, and the other key indicators is about how many people are dying, hospitalization, the rollout of the vaccination program. It's also going to be a kind of a combination of data that is going to determine at what speed the government is going to be changing the restrictions.
Which means that there's a risk of having another lockdown in case things are not going as planned.
Nothing can be ruled out because no one can give a guarantee that it's gonna be all rosy and nice, and no, it will depend on these key indicators that they're gonna be putting.
So we don't have to plan for holiday yet.
Not yet. I will not encourage anyone to plan for holiday.
God forbid.
But
No holiday.
No, we really need holiday.
To get out. 2 years old.
That would be too much.
so
So what about? Are we again?
No, well, time is
No.
always against us,
I've
but
got
we still
two
got
more
a few. Yeah, go
questions.
on.
So can you quickly just explain the roadmap, just for those who've not, how is the government planning the slow roadmap to?
let me just check some. The roadmap, I do have it. Let me just explain to you. 1 minute.
Okay.
So the roadmap is going to be like this. They're going to be, the priority is the education.
Yeah, so, Mom, can you translate what I said?
Tant que zo bima na lockdown, ezali beaucoup plus pour na bandela d'abord na éducation ya bana.
Yeah, on the 8th of March, the colleges and the school going to be opening.
Le 8 mars déjà, école nyonso ezali ofungwama.
And the practical higher education courses will be opening.
Ba collège pe ezali ofungwama.
Yeah, we've been pushing for how to minimize the risk in the schools.
Nous sommes en train de travailler pour voir comment on peut diminuer les risques de transmission au niveau des écoles.
Each school is going to have a testing facility.
Chaque école aura une station où on va commencer à tester les enfants.
And every 2 weeks, children will be tested.
Et c'est chaque 2 semaines que les enfants vont passer ces tests de
And
COVID.
some of them, the school will teach children on how to test themselves.
Et il y a des écoles qui vont apprendre aux enfants comment faire ces tests-là eux-mêmes à la
And the
maison.
parents will be also invited to help their children
Et les
to
parents
make sure that
seront
they
également
get
aider
these
leurs
tests.
enfants à faire ces tests-là à la maison.
Yeah. So there is no need to open schools if you do not put in place a way of controlling those
Ça aurait
infections by
été
testing.
irresponsable de demander aux enfants de retourner à l'école sans mettre ces mesures-là en place.
And again, social contacts will be changing. Rules of 6 when it comes to 29.
À partir du 29 mars, 6 personnes peuvent se rencontrer dehors.
Yeah, and the organized outdoor sports will
Et puis les
be.
sports dehors peuvent s'organiser également.
Yeah, and then going to step 2, education will remain in the same setting. That's the program. And the rules of 6 will remain the same. And the business activities will start to reopen
What's that?
on the 12th of April.
À partir du mois d'avril, les autres commerces vont commencer à ouvrir.
Yeah, and the step 3 will be around the 17th of May.
Vers le 17 mai,
Yeah, indoor hospitality will open, entertainment will
les
open.
restaurants, les casinos, les pubs, cinéma. vont
Yeah,
commencer à
travel
ouvrir.
will be international travel will
Youpi!
will be reviewed.
Ah,
That's the-
review!
yeah.
Ah, ok. Et les voyages internationaux pourront reprendre. Ils vont revoir si on peut accepter que les gens commencent à voyager.
Then the last step will be on the 21st, where they're going to be looking into removing all the restrictions.
Et c'est
All
le
this
21
is subject to the
C'est le 21 juin qu'ils pensent qu'ils pourront lever toutes ces mesures, mais ça peut toujours changer.
there'll be, when you give me time, there'll be few things that at the end I want to tell to people. Is in many who are listening live in the UK?
Yeah.
Okay, there'll be few things that I wanted to tell.
Yeah,
Please go on.
Yes. Okay. First thing I want to tell them is opportunities. I don't want people to miss opportunities.
La première des choses que je voudrais demander à la communauté, c'est de jamais louper des opportunités.
Very important, people who are working, who are told by NHS trace and test program to self-isolate, they are entitled to apply for 500.
But you know, there are quite few people, they've gone into isolation, but they never got the money.
This is why I want to talk about this, because I have realized our communities, they don't apply for this.
Voilà. Français ou lingala pour que les gens comprennent. Je sais pas qui nous
Very
suit.
important.
Je sais vraiment pas qui nous suit. Je vais essayer de le dire en français et en lingala.
Oui.
Les gens, il faut. Monsieur Kourouziza nous dit qu'il ne faut jamais rater les opportunités. Dès qu'on vous dit qu'il faut vous aller en isolation, il faudrait demander à la mairie de vous payer 500 pounds parce que c'est l'argent que le gouvernement a mis en place pour vous aider à subvenir à vos besoins pendant cette période-là. Donc, ce qui est salami que NHS a bengi à l'obinao que vous avez Covid ou bimali sous-souté, benga city council na bino ba pesa yo 500 pounds parce que zalimbongo oyo ba chie qu'on a aider yo na période wana a remarqué que ça ba te belé ou ba zu amoté.
We have realized that people are not applying for this because they don't know.
Et beaucoup de gens ne demandent pas cet argent-là parce qu'ils ne sont pas au courant qu'ils sont.
So if you go on our website, it's called Test and Trace Support.
Donc, il faut qu'il y ait une website au monde en gros, bah, comme Trace and Track Payment.
Yeah.
Il y a NHS. Il faut que ça NHS. Il y a bateau bah outil voyage te oyo le bi babi no za na isolement au senga 500 les akabat oyo NHS yemuko a bengi.
Yeah. The second thing I want to tell to people is about I don't know if they have heard about the rapid test. Have you heard about rapid test?
Yeah.
The rapid test means they test you and in 30 minutes they'll give you the result.
Il y a également le test qui est rapide, donc vous allez vous faire tester et puis 30 minutes après vous avez les résultats.
Again, if you want to apply for this, you have to go to on our website. In Salford, we do have a center in Eccles. That's
Il y a
where
un centre qui fait ces services-là à Écosse si vous habitez Salford.
And the third thing is about if you do have anyone who is listening, who is a taxi driver or private hire,
Si vous êtes un chauffeur taxi, veuillez bien écouter.
you are also entitled to a grant of £500.
On peut vous donner un financement de 500 pounds.
And this one comes under additional restriction grant.
Ça vient sous additional restriction grant. Donc, il y a un financement que l'on donne aux chauffeurs taxi pour leur permettre de subvenir à leurs besoins pendant cette période difficile de 500 pounds.
This is to recognize that.
What are the conditions? What are the criteria to get that 500? Just to be a taxi driver.
I do not have the conditions
Please
here.
get information because within the community we've got so many
This is why I brought it.
So that we can
I
share.
will email you some information about that.
Okay.
Then you can give to the people so that they don't lose out to the opportunity.
Chauffeur taxi, en tout cas, ils ont l'information qui te répond à 500 pounds.
And those who are self-isolating as well, who have been told to self-isolate, and then some people cannot afford to be at home because they have to pay for bills and so on. Last information that I would like to give, please, those who are undocumented migrant, there is a problem for them to get vaccinated because they need to be registered with a GP and they need to have NHS number. So if you do not have an NHS number, you don't get vaccinated. But you know, some undocumented migrant will not have that.
Yes, there's an update. They say that now they won't ask anybody about the ID or the NHS number or immigration status.
Yes.
You just go for the vaccine.
Yeah, but the problem is how they're gonna know that they've been called for a vaccine because they don't have a fixed address. So if you meet anyone who might be in that condition, please encourage them to go for vaccine. If you don't know anyone who's struggling, let me know, or people will manage to do that as well. But let me know, or let us know. We can do what we can to make sure that everybody is vaccinated. Thank you very much.
There's a question here. What will you advise someone who had vaccine about wearing masks in public places?
Sorry?
what would you advise someone who had their vaccine about wearing mask in a public place?
You mean people to wear vaccine?
Yeah, if I got the vaccine,
you already
do
have the
you
vaccine.
still do you still need to
to
wear
wear
a
your
mask? Why would you wear a mask while you've got the vaccine?
It is advised that even though you have taken the vaccine, it is important to think about others. It's about also protecting yourself, because the vaccine is not 100%, it's 95%. You might be unlucky for the 5%, you'll be part of the 5%.
And also because of the new variant.
And the new variant as well. So it is important to,
And also, I
to
believe,
look after yourself and then look after others.
yeah, I believe just because, last time we touched on it, even though you've taken the vaccine, you can still
Be
get
infected.
the disease, or you
Yeah.
can still infect other
Infect
people.
others, yes,
Exactly.
correct.
So
correct.
it's not 100% like...
Correct, correct. So it's about social responsibility. It's not about me or someone else. It's about thinking collectively. How can we look after everyone?
I will one day forget about living with mask, gel, and going back to normal. How long is going to take us to
It
go
is.
back to normal?
I do feel that we will have to find a way to live with this vaccine.
Okay.
That's how I feel. It's gonna be probably this vaccine is gonna make a difference, but there will be precautions that we need to undertake to make sure that we suppress this virus, the spread of this virus. Otherwise, we will have to learn to live with it.
Okay.
Very last question. Very quickly, throughout the pandemic, obviously mental health has been very, very serious because we went from a very, very busy and fast-paced community to a complete shutdown, and it's caused quite a lot of issues. Now, my question is, the government has been trying their best to, work with people suffering with mental health and how it affects people. Are they now looking into, once we go back to normal, the people are literally now living in fear, and they're going to struggle to kind of let themselves go. Is the government looking into that? How are they going to help people to be able to go back out there and
This is
feel normal?
This is something that has been talked about. They've been talking about the long impact of this lockdown. It's going to be massive. And on that, you have to add on the loss of jobs. So people are going to lose their jobs. It's about dealing with the loss and the grief. So it's going to be a massive area. So the government, I'm sure the government will be looking into how sustainably on how they're going to be supporting people with the long-term mental health caused by the pandemic, loss of jobs, loss of the loved ones. So it's about dealing, it's going to be massive. I do feel
mental health project in the community every Saturdays. And you really need to find out a bit more about the strategies of our local authority about mental health so that we know how we can back up that.
Yes. Maybe we could have a conversation at the moment. They are talking, as we are coming towards the end of March, they are talking about the budget. So at the moment it's not clear how much is going to be allocated to that and the strategies around that. But definitely this is one of the...
I like that word budget.
The
For some reason, I like that word budget.
We all like that.
I like it too. Yeah, I got a question. For our studio, we are trying to reach our community in spreading the news and spreading what is happening. Because I've noticed you say that there's a few help for taxi drivers. Is there anything for the African media that we are with Phoenix TV? That is there any help that we can get from that? situation.
Yeah,
as well.
I'm sure there is a lot around there. It's a matter of looking at what you want to do and what kind of project you need to do. And they will be good to start linking with maybe BBC just down the road. And they see when we go back to normal, you'll be more, you'll be able to do more out there. But at the moment, it's all, not going quickly as we wish to be.
Okay.
But I'm sure there will be a lot of support around there.
Oh, thank you.
If I do get across with any opportunity, I'll be more than happy to pass over to you.
Oh, thank you. Well, I don't know if we have...
No, I've asked all my questions.
You got
I'm
your-
sorry
what
that
about
you
you?
asked my
Yeah?
questions.
Okay, now, I want you to look at the camera and speak to somebody regarding this vaccine.
Yeah.
Somebody who's a bit hesitant, somebody who's not sure. So if you can speak to them, and I would love for you to speak to them in your native language as well.
In Kirundi.
In Kirundi, just so that
Okay.
you can
And
give them,
Kirundi,
you can give them,
Swahili, Lingala,
yeah, because I mean they're watching you and they're thinking you're their son, so it would be lovely for them to hear you speak their language as well.
Do you want me to speak to my native language?
Yes,
Okay,
just
good.
send a
Just send
message.
a
You look at the
wonderful
camera and
I'm happy to do so.
thank
Yes.
you.
Ndashaka kubwira abantu bose bariko baratwumviriza icya mbere na mbere ni uko akazi mukora ari keza cyane kumenyesha abantu ibiba biriko biraba muri kominote. Ndashaka kubasaba umuntu wese bosaba yuko yoza kwiteza urushinge rwa vaccine yuko yogerageza akagenda kugwiteza kuko ruzokingira wewe nyene ugiye kugwiteza umuryango w'iwawe ababanyi b'iwawe eka abo b'iwawe bose bashobora kuba bari iruhande yawe. Cyo gituma rero ufata iyo vaccine na jewe hageze yuko bampamagara yuko iyo vaccine ndayifata nzoheza ndayifate.
Can you please translate that?
Elisa was about to translate. She was ready for
So I just said that to anyone who's listening, if they do call you for the vaccine, please do take it. It's a lifesaver. It will save your life, your loved ones, your neighbor, and everyone who may come across to you.
Oh, thank you.
Thank you so much.
Thank you.
so
So,
much for your
thank you.
time.
Yeah. On that note, we say thank you to our viewers. Thank you for keeping up with us. I hope the information that you received, have enlightened you and helped you make that right decision. So until then, we say goodbye. Take care.
Thank you very much. Thank you.
Bye.
Thank you.
I know who God says I am, what He says I am, where He says I'm at. I know who I am. I'm working in power, I work in miracles, I live a life of favor. For I know who I am. I'm working in power, I work in miracles, I live a life of favor. For I know who I am.
awa oza na posa ya ndunda oye kozwa ndunda ya bio naturel babanana plante ya naturel baza na bainiam bakokoti na bamanioko bambala sukali ezali toza na basweet corn mama oyo ayebi kotumba liboke oyo okoki ozanga yango te voilà wana koto département ya fresh nyonso fresh toye koto oyo awa nde toza na badrink awa koto nyonso eza badrink na badrink nyonso oza nango mposa mpona babefte na bino mpona célébration na bino bafete na bino bajus eza wana toza koto na babiloko nyonso ya baépice donc bafufu nyonso bafufu bamiliki donc bacéréale awa koto nyonso kosoba baza na nyonso kuna tokei boya s'il vous plaît oya boye nao namona te magi ya monene boye kaka awa na ades so baza mpe na butchers donc côté oyo bapapaka bangombe bapapaka bantaba olingi ntaba feti eza awa nyonso tu okozwa yango mpe prix na bango eza abordable tous les sortes bambisi eza awa batilapia bangolo batomsone bakatia mutu bakata mbisi nyonso eza awa mpo tokende kosukisa na département ya bachicken baza na variété nyonso ya bachicken ya bafish ya banyama donc awa boza ya kosepela soko fungoli ah donc bamisuni ba chicken variété nyonso to ezali eza shop moko munene makasi bandeko boya ebele pondu na bango eza 1 pound donc toza na bandunda kuna ya fresh légumes fresh toza pe na ba légumes eza frozen mama toza na mbika awa ndeko ta mbika oyo esi banikeli yo oza na mashini te na ndako konyoka mateyaka kaka mbika konika oyo penda na mbisa kokauka oyo obakisa ngo na kosa oza osepela ti libumu naomba moko ebini non eza wonderful bino mongo boya ko visiter ezaka ana Gruet Chitam Street numéro 320 pe bazofunga na bango Monday to Saturday à partir à 9h ti 20h baza awa so okoti moko omonaka okamwa awa tozaka na Ades shop na biso mikolo ebimi na Manchester ezaka yango moko ya ndeko na biso africain siko koto yo toza na sima poni to ekolakisa bino na sima po toyebisa bino ke parking ezali mama konyoko mateo na ko parkele wapi non Ades abongisi parking ne ya kitoko ya munene otala na Ades kitoko